I'm Dr. Foojan Zeine, and welcome to the Inner Voice Show, the show that's about you and what matters most in your life, and we talk from a psychological perspective to the experts in psychology and in their own field. So today, I'm excited to have Dr. David Shapiro with me. He was my guest before at our show, and he was in the studio. However, today, he's going to be via Skype with us. If you would like to watch the last show that we had together, please go to the YouTube channel that you see on the screen and go to the channels and look for his name, Dr. David Shapiro. He's a psychologist who has a private practice in Irvine, California. Dr. Shapiro, it's a joy to have you back on our show.
Well, thank you so much. It's an honor to be with you.
I know that last time we were talking about therapy, and you've been a therapist for, psychologist and a therapist for more than 20 some years. And many of your experience have gone from psychodynamic to cognitive behavior to the past, to the present, to the future, and you have learned so many different modalities that you have helped your clients with. And so it'd be great to talk about how does therapy heal people? I know that in California, in New York, in many of the states, the therapy and the amount of therapists that are there are a lot. And therapy by itself has been it's been a field about more than 100 years old. So knowing the different modalities, going from deep all the way to strategic, from long-term to brief therapy, I know that you have experienced and worked with your clients in many, many realms. So talk to us about what you think therapy is and how it heals.
Well, thank you so much. And I just want to say that I think you're being a little bit modest in also saying that you have a tremendous amount of expertise in this as well. So I'm really looking forward to hopefully being able to hear from you as well, and
maybe we can kind of have more of a discussion rather than me being the expert. But
absolutely.
But I think
what you're saying is a very interesting question, which is how does therapy heal? And I don't think that every therapist is really focused on healing per se. I think. Really, you mentioned a lot of different approaches, and I think these days, especially with managed care and a lot of limitations that are put on a lot of therapists, there's been more of a focus in terms of maybe putting a Band-Aid on things or giving people a couple of skills that they can use to cope. But when you bring up this question of healing, I think it really is suggesting that some of us maybe are not just satisfied in teaching people a couple of techniques that they can use to calm themselves down, but really to make a transformation. And so I think that I'd like to first just acknowledge that there are people who have had very difficult experiences in their childhoods that still affect them. And so, I think that when we're talking about this notion of healing, I think that we're really talking about trying to help people make a deep change in terms of how they are thinking about and feeling about themselves and their connection with other people, and not just somebody who maybe is like having just a stressed out experience because of something going on at work or something. I mean, it could manifest as that. But I think we're talking about people who are really burdened by the impact of things that happened in the past. And so I wonder, even before we talk about how we really help those people, I wonder if you also maybe might have some views about those experiences and the impacts that they can have on a person, for years to come. And
right.
If you and I know you yourself have a model that you use in therapy that I think really gets at this. And so when I say that I'm honored to be here with you, it's not just honored to share something, but it's really I'm honored to join with you on this very profound topic that I think has meaning to both of us. So
Thank you.
So I guess, so I guess I would ask you, when I'm talking about people who have really been impacted by events, growing up, whether it's a trauma or maybe some really difficult family dynamics or something. Do you have anything to maybe share with just understanding how that lives on for some folks?
Sure. I think that you're absolutely right about how therapy has changed during the years. And it has changed not only because of managed care, but I think there have been different types of theories that have come. And I think that there are one-time therapies or one-session therapies. And I know, I think it's Dr. Michael Hoyt, which wrote a book about one-session therapies, because what they found out even from researching from the managed care and insurance companies, they found out that how many people just kind of go one time because they're upset about one thing or they need a solution on one subject. So they go in, they get, they present the problem, they get some sort of a solution at that moment, and they go home and, they've got their answers, and that's all they needed. They needed one aspect of a skill or get clarified about one thing that they already knew. The other forms are, between 10 to 12 weeks or sessions, which is more of a brief therapy, which is, again, a little bit more solution-focused work, where they look at what the issue is and they look at how they, define it, clarify it, create some solution for the future, and give them the skills and practice a little bit in order to do that. And then we used to have, and we still do, have psychodynamic, psychoanalysis, and a little bit deeper working, where most of the people have been working if they've had trauma or childhood trauma or longer issues, or they've gone from one issue to the other because they've had one issue that kind of showed itself all over, maybe in their relationship, in their work, in their finances, and all of that. So they took longer in order to look at deep-rooted matters and try to kind of disassemble the deep-rooted matters in order for it to alleviate from the areas of their life, and then from there to be able to do that. And I think part of what we talk about healing is more about something that happened, whether it was a big trauma and a sudden thing happened to them where they felt devastated, or it was more of a condition of parenting or growing up in a situation that they've created a lot of negative beliefs, and that's how therapy worked for them. And some people do it often both ways, where once in a while they go to a therapist and do it in a short spurts until they hit at a position that they really want to work on a deeper issues, and then they'll commit themselves to a 6 months or a year or more of therapy in order to go and heal themselves. And I think that part of what you were talking about, the model awareness integration that I created is more like you could do both, that it's open enough to be able to handle an open structure, but it's also structured enough that will handle all of your life and the past, present, and the future, where it can be very comprehensive depending on what the client's issue is and depending on how much they really want to work on themselves and the commitment that they have.
Yeah, and I just want to say, my experience has been that I can do this deep healing without it having to take forever. So, especially with now my intensive study that I've done with Dr. Michael Yapko in the area of strategic psychotherapy and integrating hypnosis with very strategic interventions, I've been able to see people get the kinds of results that folks used to take years trying to achieve within more of the time frame that you're talking about, for like a brief psychotherapy, very often within 15 sessions, I see what I would, really consider deep healing, but it's because there's certain things that I'm doing that are different than what people traditionally do when they're doing just something like cognitive behavioral therapy. And what I'm doing that I think, as I've been reading your book that's coming out, and I really hope that we can share a little bit about this this anticipated release of your book, because I think it's just a real gem for the field.
Thank you.
What it is that I think we both are doing that really gets to this area of healing is we're engaging with people experientially about not only their experiences in the past, but also in the present, and then projecting into the future. And I believe that it's the experiential aspect of therapy that really allows for healing, as opposed to just teaching a coping skill. And I wonder if that makes sense to you, based upon your experience as well.
I think that there's the element of healing happens in a couple of different realms, and I work with it in the awareness integration model. And thank you for pitching in my book. The book is supposed to be released in April of 2017. It's called Life Reset, and it's a workbook that actually goes through the whole awareness integration model for the person for a reader to be able to go through it and work through the examples and the exercises to complete and let go of a lot of the issues and move on to the future. The important factor that you said, though, I mean, everything happens in the present moment. No matter what do we want to change, it can only happen in the present moment. We can't do anything in the past. We can't really do anything in the future either. However, the future is something that calls us forward. And if we don't have a future that excites us, we get depressed, we get hopeless, and we don't move forward. We have no motivation to move forward. So that's why future is so important. And if we decide that the future is going to be negative, we carry the depression and anxiety and low self-esteem and low self-confidence with every step that we move forward. So obviously, if a future hasn't happened, why would we want to put something negative in the future and project it there? So we really want to create those goals to be something that is positive. However, most people, the only reason they project something that is very, very negative into their future is because they've had a really traumatic or a bad experience, a negative experience in their past. So it appears that as long as we don't clear the past, it insists to keep coming back and muddying the present moment and the future for us. And we just won't get complete with it because we subconsciously reliving the same scenario constantly over and over again. So I think that's probably why it's important to cherish the present moment, because today is where the change happens. Today is where we can do something in an action-oriented way to change the path that is going from the future toward the future. However, we got to complete with the influence of the past, learn from it, move from it, heal it, and then, continue moving. So I think the healing happens mostly when we're conversing about the past and completing the past and moving forward. But then the action actually happens today. And the only reason we're creating the action and the way we're creating the action, and I'm talking action as far as whether it's a verbal or doing something based on a thought or a feeling, and that type of a behavior and action usually is toward creation of something in the future. And that's how these time elements and kind of coordinate each other and become one in one instance as we're working in therapy.
Absolutely. And it's so, when you explain that, I think it's so much connects to so many different lessons, both within psychology and also from other wisdoms that we have. Even within the field of psychology and psychodynamic theory, I think about Freud saying that we view the world through a dense thicket of absent others, and so one of the important, I think, gifts that I've gotten from studying and working within psychodynamic therapy is really learning the importance of people recognizing how they have in many ways, distorted perceptions and expectations of their life based upon their earlier experiences. And I think that, like, there are many times that people are wearing their glasses and they are looking all around for where are my glasses, and it's because they're using the glasses so habitually that they forget that the lenses are there, and they think that they're just viewing the world as it is. And so one of the things that you're saying about your model that I think is so important is that it brings to the awareness of the individual that that the way I'm seeing things is based upon something from the past. And then what's very interesting about a word that you used is you talked about completion. You said that there can become this completion of whatever this is, and then that releases the person in some ways. Is that, am I hearing you correctly?
Absolutely. The way you put it, it's so true that the way that we experience life, every one of us perceives whatever happens in our life in a particular way. We make decisions upon it, we add it, and the latest research says that everything that we learn in the mornings, at night and during sleep, they go through our memory and get kind of filed in the memory, but the way that we choose to file them in the memory, it has to do a lot with the emotional charge that event had for us during that day. And then we usually put it in the same type of story or the scheme or the film or theater that we've created in our head, and we fit it in the same concept. So we create our own self-identity by doing this every day. So we could see if, as a child or in the environment that we were, or based on issues that have happened, we come up with some organized thought process for ourselves, and then we reorganize it consistently. And we base our identity on a narrative and a story that we're consistently creating for ourselves. And what if that story, based on one small concept, became generalized in our head? This is what cognitive therapy says, that we generalize issues and we make it all of us and all of the world, and then we deal with who we made ourselves to be and who we made the world to be in creating the rest of the story. So we could make comedy film, or we can make a horror film, or we can make a totally drama and dramatic film, and we could create all of this thing based on who we said we are. And what if that's just not true? And I think that's what we do in therapy. It's like we challenge the way that the person has figured out themselves on the world, if it's not working for them. And if it is working for them, hey, we're gonna salute it and work toward it and move forward. But any aspect of it that is limiting, is not working, creating negative beliefs and destructive behaviors for them, we want to kind of shake it up. And by shaking that up today, obviously we would have to go also and see where the origination of that decision making was, and also handle it. And handling that is not always on a cognitive level, because obviously if we stored something, it must have had an emotional charge. That's how we do it. So then we have to be able to release those emotional charges. And doing that is what healing is about. And I know that you also have, based on your experience, have done a lot more with hypnosis and meditation in bringing and focusing to the body, to those thoughts, to being able to go into who you are in your center, and then heal yourself and then come back to the present moment. Can you talk a bit about that?
Yeah. And so I think a number of things that you were saying, I think really reminded me of some things related to that are very important. And so one of the things that I just want to maybe connect to or echo in what you're saying is, so really I think there's kind of a couple of different levels to the healing process and to the change process that I think are very similar to how the distorted or not helpful thing got stored originally, which is that there's really I think maybe two, and I think probably would say maybe more steps or levels that have to occur, and you're saying that one of them is that there has to be an emotional charge or an emotional engagement, and then there's like when you talk about like how things get then kind of stored or made sense of later on when we go to sleep and at other times, then there's a making sense of it, or kind of a narrative, or we might say forming of a cognitive schema, or perhaps a core belief. But that's the meaning making level of things.
Yes.
And so when I'm saying that what I've learned is that I can really help people get deep healing by engaging on an experiential level. It really involves engaging with the emotions, not just the narrative, not just the thought. I think that, but it's very important to join with the narrative and the thought, and then even come up with plans and behavioral strategies and other things that grow from that toward the future. But what I really believe is that it's very helpful to bring up the computer file, bring up the experience, and you talked about, and you even talked about it, I think something like a movie or something like that, and I love that language because I think for many people, sometimes it can involve connecting to the actual experiences that they had, but sometimes it can involve doing some sort of emotional visualization or engagement around something that could even symbolically relate to those experiences, and that then, when that happens, I view it like kind of bringing up the computer file. You're engaging the deeper limbic system, the emotional and memory centers of the brain on an experiential level, and when we do that, then I think there's a possibility of kind of making alterations or you said completions that can then get stored in a way that then the computer file can have some edits to it and can no longer be causing the disruptions that it's causing, or ideally can then start being something that can be a resource that the person can draw upon that can really help them in the future, and that's really the ideal goal. Sorry, my light turned off a bit, but I'm sitting too still here. And so I think if we wanted to make this more real for people, I'm kind of thinking it would be interesting to think about some examples, where we might do this in therapy, and how it could help a person, and like you were talking about some of the different experiential techniques that I use, and maybe I can sort of share some of them and talk about how I might use them. And so when we're talking about the impact of these traumatic events or upsetting family dynamics, one of the areas that I frequently find this playing out has to do with the area of relationships, and very often a person will come to me and they're having problems in their marriage or some other relationship, and one example that I can think about is a gentleman that I'm working with who is getting extremely angry at his wife, and he is saying, he's very often very agreeable, nice guy, not only with her, but in other parts of his life. But he's been having these episodes where he blows up and he lashes out at her, and really when that happens, it's very hurtful to a relationship. You can't really unring that bell, and he's very concerned about this.
Right.
He doesn't want to continue to do this, and so he came to me, and we're still working together. It's only been a very short time, but he's made tremendous gains already, and so in starting to understand what's going on for him, it quickly became apparent that the situations in which he's yelling and getting very angry at her are times that he's feeling like that his needs are not important, that his feelings aren't important, that he's feeling that he's in this position of doing all the work and she's taking it for granted or something. And it was not a surprise to me that when I heard about his childhood, he told me that he grew up in a family with an alcoholic father, and he used the exact same words. He said that I wasn't important. I was, and so clearly there's a connection. Clearly, the experiences that he's getting so upset about now are triggering off something from his past, and
right.
so there's and he wants, when we talk about projecting into the future, he wants a situation where he can have a good, peaceful, mutual relationship with his wife, where he's able to, communicate with her about his needs and wants, but in a respectful way, and so forth. And so that's where he wants to get, and where he is kind of more like half the time just being completely agreeable and not speaking up, and then half the time blowing up. And so as a clinician, many different therapists would approach this, in a variety of different ways. And, some people might just teach this guy some anger management techniques, or some people might teach him some assertive communication skills, or some people might decide that the couple needs to do some kind of imago therapy, and
right.
Try to work on their understanding each other's deeper childhood needs and so forth. And I really think that the therapy that I'm doing with him is an integration of all of those things, but the steps that I'm going through are, as I've been observing it, are very have me noting that these are common steps that I use with a variety of people who have these experiences. And so one of the first things that I find extremely useful to do is to help the person be able to quiet down their rage, their strong kind of emotional overreaction, and to be able to engage with their emotions in a way that aren't overwhelming. And so for me, some of the things that I've started to incorporate with this gentleman is one, you're talking about meditation. One of the fundamental kind of skills that we teach people when we teach mindfulness or meditation is to learn how to quiet themselves. And really, the term mindfulness it also refers to learning to stay in the present moment. And so for me, that sets up, if I strengthen that capacity, then I can help this person engage with their emotions in a way that isn't overwhelming, and isn't re-traumatizing, and in which then they can use their awareness in a strategic way, and so forth. And so one of the first skills that I'm teaching this gentleman to do is to just stay with his breathing, to slow it down, and then stay with the body awareness, stay with an awareness of what's happening, in the room, and so forth. And that can happen very, very quickly. I support it with then connecting him with some self-help kinds of applications, apps that they can use for computers and cell phones, one of which is through a company called Wild Divine. And they have a program called Relaxing Rhythms, where Deepak Chopra and Dean Ornish and Andrew Weil and all kinds of really renowned teachers of meditation teach a structured emotional management training program.
Right.
I think it's available for something like $9.99 on the App Store.
Yeah.
But really, like, by getting him and teaching him some of these techniques, getting him practicing doing that, then within a week he comes back, and now we're ready to start engaging with the emotions, with the images that come up, and then give him some, various therapists might take a variety of approaches, but to give him some experiential strategies which then he can start using when these things get stripped up. But the important first step for me is to teach a person to be able to not get overwhelmed, and that it comes from so many different schools of psychology that I've studied, but one of which is the area of cognitive behavioral therapy, and there's been such a great body of research that's shown us the importance of what's called exposure with response prevention, and a good example of that is systematic desensitization.
Exactly.
Where people, but it's also been expanded upon in therapies like EMDR and a lot of other experiential therapies, where people learn how to stay calm, and then by engaging with things that had previously been upsetting, they desensitize themselves and no longer have to have the emotional overreaction. And so, it would be interesting if we just maybe wanted to do a little consultation about this case, and maybe talk about maybe some different junctures that you might use. But I guess one of the things that I would say is by beginning by helping the person no longer get flooded or traumatized, that sets up a great foundation to then get in and do deeper healing.
Exactly. And since our time is about up, I just want to kind of summarize what you were saying also for our audience to know that it's so important, and the research has shown that no matter how much new skills you have learned in your frontal cortex, that when there's an emotional charge that comes in and triggers you, that sometimes it bypasses all of the new skills that you have learned. So it is so true with what you're saying, that learning to immediately managing your emotion and the high negative charge that is coming, and the ability to calm yourself down before you speak, react, and do anything else, it gives you the opportunity to have access to all of the skills that you have already learned, and to have access about all information that is in front of you versus only the information that has triggered you from the past. So the type of meditation you were talking about, or different types of relaxation, or learning in how to release your emotion in a safe way at that time to regulate yourself back into a neutral zone before you start conversing or acting or making decisions or doing anything else. It's so important. There's another aspect of it which I hope that in the next time that you and I are together in the show to continue to go on is part of the reason I was also gravitating to a deeper level with the awareness integration model and finding something new was also, David, what happens is we get triggered, and half of the time we act, we damage, we do a lot of things before we realize, oh my God, what have I done? So it's very hard to be able sometimes to regulate yourself, but even if it's easy, you still go through the whole activation before you catch yourself. You calm yourself down and do that. And the best that we've been able to do that so far is this. And for us as therapists, the best that we were being offered was that. So it was more like, okay, but we created the stories. How come we can't dismantle the stories? We've got to be able to do that, and not just from a cognitive place, but is it a way, that we can completely, not to go, in short of lobotomy, that we just take the whole way. There must be another way of being able to dismantle these things we've created. And that's how, the other aspect of this was born, and I'm sure that we'll get to talk about it more next time we're together. Thank you so much, Dr. David Shapiro, for being with me on my show and giving me and the audience a lot of your expertise that you utilize every day in your office. And hopefully you'll be my guest again.
Well, thank you so much. It's really been an honor, and I'm so glad that you're suggesting a follow-up conversation because, this was just maybe the beginning, and there's so much more now to build on what we just discussed.
Yes, absolutely. Thank you, all of you, for being with us, and until the next time, create a wonderful world for yourself. Bye-bye.